Welcome to Health Matters. My name is Sherri Gallant with Alberta Health Services. Thank you for being with us. We have a great lineup of guests today to talk about all sorts of health and community issues, one of which involves tobacco cessation. Earlier in the year, it was National Non-Smoking Week, and that's behind us now. A lot of attention is paid in the media to that specific week and gives people lots of advice on how they can stop tobacco and what supports are available to them. But down the road, sometimes you still need support. So I'm here today with Chloe McNamee. She is a health promotions facilitator with Alberta Health Services here in the South Zone, and Chloe's going to tell us what kinds of things we can do. Welcome.
Thank you.
Since we are past National Non-Smoking Week, just tell us a little bit about that particular week and what the purpose is of it.
Yes. So National Non-Smoking Week typically runs in the third week of January, so right after those New Year's resolutions are set. And it is it's been running for 30 years annually across Canada, and we just try to raise awareness about the health effects of tobacco and how we can reduce those nationally and provincially and in our local communities in any way we can, and just to also raise awareness about the different supports in your community or wherever you are. So it's just kind of that week to raise awareness in tobacco reduction and helping people quit smoking.
Let them know that they don't have to be alone in this and that there is help available.
Exactly.
So each year, I guess, has a theme, and this year the theme was, what are your reasons?
Yes.
Can you expand on that a little bit?
Definitely. So yeah, this year the Tobacco Reduction Unit, they're a provincial program, and they set this theme of what are your reasons. And so it was kind of interesting because you could kind of play with it however you wanted. And so what are your reasons? We all know that people have something that is motivating them to quit smoking, hopefully, or quit their tobacco use, I should say. And so we want to just highlight that people focus on those reasons so that it kind of drives a personal meaning towards helping someone quit, because it is a difficult feat to go through, quitting tobacco use. Mm-hmm. So we want people to highlight what their reasons were. Is it money? Is it family? Is it their freedom? Is it their health? And just to remind themselves of that when they're going through these quit attempts.
So when the going gets tough, keep your eye on the long game.
Exactly.
Yeah.
That personal motivation, personal readiness, personal drive to keep going. Why are you doing it?
Okay, so having explained all that, then can you provide our viewers with some tips on what to do to help reduce tobacco use? Because it's not necessarily just smoking. It could be chewing tobacco or even vaping, nicotine.
Yes, exactly. So what we tried to focus on with National Non-Smoking Week is try to think of quitting your tobacco use in a smaller portion rather than this long and drawn out process that is going to be really difficult. Try and do a practice quit. So whether that's 1 day, 3 days, 5 days, just see how it goes and write down in an app or a journal your cravings, any triggers that kind of come from what you're going through with your quit attempt, and just have that short goal in mind. I'm going to stay quit for this amount of days, this amount of weeks, whatever you can commit to, mm-hmm. and then just see how you go from there. And what were the challenges you faced, what were the successes, and then that can kind of give you some motivation to keep going further or try another quit attempt. Because we know that, it's a difficult process to go through, mm-hmm. and so you may not quit successfully long term the first time, and that's okay. We learn from the process, and you just keep going and figure out what works for you. So just finding that confidence and readiness in a practice quit.
That sounds so much less intimidating.
Yes.
Than the great big, I have to quit, and if I fail, then I failed. Mm-hmm. But if you give yourself permission to do it, to just try it out, as you say.
Be
practice.
Easy on yourself when you're doing it, because mm-hmm. it is quite challenging.
Mm-hmm. I guess emotionally as well as physically.
Definitely, yeah. There's a lot of things that the body goes through.
So in Alberta, what is our province focusing on to help to help populations reduce their tobacco use?
So unfortunately, our tobacco rates have increased in this last year.
Oh. So
we are definitely still trying to put all our efforts in trying to help people reduce their tobacco use in Alberta. So as I mentioned, there's a provincial-wide tobacco reduction unit, and they specifically focus on tobacco and different reduction and cessation strategies. So their website is called Alberta Quits, and they provide different programs to help people quit their tobacco use. So just to highlight all these resources, because they're free and they are accessed all throughout Alberta. So you can have somebody that you call through a helpline, and they're a trained tobacco counselor. And so you can just kind of chat about different techniques and have some support via that health professional. Mm-hmm. There's a text to quit program, so if you'd rather have some support with the convenience of your cell phone, you can have that program. You just set it up, and it's all the information is on Alberta Quit's website.
Okay.
And there is also a Quit Core program that they run, and it's 6 weeks, and it's for people who are trying to quit their tobacco use. And so this program is designed to build skills and try and change behavior around tobacco use. And they learn from their peers, because everybody that is in the program is in some way trying to quit tobacco. Mm-hmm. You don't have to be quit before you come to the program. You don't have to quit after you finish, but hopefully what you gain from the program is that you take different skills and behaviors to try and help that. So it's all free, and they're run throughout Alberta. And so you just check with Alberta Quit's website or talk to the helpline and see when the next available Quit Core program is in your area. Mm-hmm. So just different things like that we're trying to focus on. And there's tobacco reduction counselors in many areas of the province as well that people can talk to. So a
wealth of information and no judgment.
No.
Available 24/7 also.
Exactly.
Yeah, so if you want to get right on that, whether it's for yourself or someone you love that you're concerned about, www.albertaquits.ca is a great place to start. Thank you, Chloe.
Thanks, Sherri.
Back. Thanks for being with us. Now I'm here with Megan O'Neill. Megan is an environmental health inspector with Alberta Health Services, and she's going to venture into some interesting territory with us about what inspectors look for, and perhaps what clients should be on the lookout for too, in spas. And Environmental Public Health recently had an initiative called Be Spa Safe. Welcome, Megan. How about if you jump right in and tell us about that initiative and what it involved?
For sure. So Be Spa Safe is all about what people should look for in salons and spas. So it covers everything from manicures, pedicures, and waxing, facials, piercing, kind of what safety features you want to look out for to try and determine if you want to use that spa.
Okay, because a lot of very personal contact in those places, in vulnerable areas of one's person.
It's true, they can be invasive procedures, mm-hmm. and they also have a high volume of clients, so that you could be exposed to germs from a lot of different people.
Okay. What is your role as an inspector in environmental public health with regard to spas and salons?
For sure. So environmental public health is all about the prevention of disease and illness. So we're trying to prevent transmission or those things from occurring. So in a salon, we would inspect and have both an education and an enforcement role. So we want to educate operators to make sure they're doing the best practices to reduce disease transmission. And we want to enforce that they're being compliant and have that power to take steps as necessary.
Okay, so when you're inspecting, you would just go in during a working day. I guess there could be clients there?
Yes, we usually like to do surprise inspections so that the facility doesn't know when you're coming in, and we try to be respectful of private client services that are being offered.
Have you ever had to encounter a situation where a client is having a procedure done and you see a violation and you have to stop the process?
I luckily haven't been in that situation before, but I'm sure some of our inspectors have been, and we've had that difficult conversation.
Unfortunate for everybody. What are some of the risks then that people face in salons and spas?
So in salons and spas, your main risks would be infection, cuts, chemical burns, or scalding.
Oh.
The four main ones. For infections, they could be bloodborne or skin infections, or something like a toenail fungus. And the main pathogens or germs that we're worried about are hepatitis B and C, Mycobacterium, and Pseudomonas, which are common from various sources.
So because it's a scientific term, what is Pseudomonas and what does it do to someone?
Pseudomonas causes skin infections, and these in a healthy individual will usually not be very severe, but in an immune compromised person, they can become systemic or bloodborne infections and have widespread results for them.
Okay, so this is especially important for people who are vulnerable, maybe immunocompromised. I would say patients with cancer, older patients.
Definitely, medications you're on can affect it. And anytime that your skin, the protective barrier is compromised, so any existing cuts or wounds, and even waxing will remove that outer barrier of your skin if there's no blood even. So that can be a portal of entry for something like Pseudomonas or another skin infection.
Oh, that's so interesting. What can the clients themselves do to protect themselves when they enter a business like that?
Absolutely. So in our pamphlet, The Be Spa Safe, it goes through what people should look for, and there's various different checklists and things. The first big point is to ask for an inspection report. See if there's been public health presence in the facility. Do we know about them? Do they have a good history of compliance? And the second one is to know what to look for. So something you want to check is that all tools are clean and in good condition. So right now you can see a photo of a rusty tool that's used in pedicures. So this tool is used to scrape off calluses of the feet.
Okay.
And it should be shiny and silver. So everything there is rust and bacteria, and if someone goes to use this tool, you should definitely say no. This was a tool that had to be confiscated and discarded at one of our inspections.
Unbelievable.
It's true, it's crazy. The second thing you want to check for is that single-use disposable items are being disposed between clients. So example, it would be sanding bands. So they're really small pieces that go on the outside of the sander, and they're for nails, artificial nail implants. Usually the sanding will involve the nail and also a bit of skin on the corners, just accidentally. So they should be brown. So a white one like this is filled with someone else's skin and nail tissue, so you don't want that used on you because that could potentially infect you when it potentially cuts your skin on the edges. The second thing to look for with disposable tools are typically disposable tools are small. So it's easy to buy a bunch of these in bulk,
Right.
and they can be disposed after clients. You can also see that it's in good condition and repair, so it doesn't look like it's been used already. So those are a couple of big things to look for. And don't be afraid to ask questions. So another thing to look for, in addition to where they clean their tools, is that they're disinfecting them at regular intervals. So they must be disinfected between clients, obviously. But there's also some tools that should be disinfected during the procedure.
Oh.
So for example, different extractors. These are to extract pimples and blackheads.
Okay.
Those should be disinfected throughout the procedure because people's pimples can be infected, especially with a pathogen called Staphylococcus aureus, and it will cause the large, gross yellow and green pus and
Yes,
swelling.
yeah.
So if that's used on one part of the face, their other pimples may not actually be contaminated with
of
that
course.
infection.
Right.
So you don't want to spread that even amongst yourself.
This is such good information. I mean, I think so often we assume that everything's being done properly and we go in for our day of pampering and we maybe don't even look. You know, we just sort of put ourselves into the hands of these professionals, but we should keep our eyes open.
It's true. It's important to know what to look for. And another thing that people can do is they can report concerns or complaints to the health department. We'll send in inspectors and do follow-up inspections and work with the operator to try and ensure they're providing safe services.
Perfect. We'll put that website up on the screen for people.
Absolutely, that website, or they can call the local public health office. In Lethbridge, the number is 403-388-6689.
And there are offices in other cities too, so we'll help people find those too. Thank you so much for being here. This is just wonderful information to share. I really appreciate it.
Thank you so much. It's great.
Thanks for watching. Welcome back. We have an exciting new development in the community to tell you about. Echo Novak from the Interfaith Food Bank, she's a community health facilitator there, is going to tell us all about it. It's the new community kitchen. It was recently unveiled. It's called the Co-op Community Kitchen. And so I'm hoping you can just jump in, Echo, and tell us about the new kitchen, what was the need that drove it to being created, and we'll go from there.
Right, so our kitchen is a great addition to the services that we already offer at the Interfaith Food Bank. We have a kitchen there already, and it's in part with our partnership with the Family Center. It's the Interfaith Chinook Country Kitchen, and it's been such a great success that people are using it. We have cooking classes almost daily there, and a lot of our community organizations in Lethbridge have been wanting to use it, but it's just so full. So we just reached our capacity there. And thankfully, with a lot of our sponsors, we were able to build our own new kitchen with the space that we had at the front of our building.
Okay.
It became vacant a couple years ago, and we kind of hummed and hawed as to what we were going to do with it. And what a better way than to help ourselves and to help the community on top of it.
Was it a long construction project?
Well, we have 3 phases, and we started building the kitchen of this summer of 2018. And so yeah, we just had our grand opening in January, and it's been a great success so far.
Busy already.
Yeah, for sure.
Who is it? Well, I guess you have 2 kitchens. Maybe you want to explain about what who are they both meant for?
Yeah, well, the Interfaith Chinook Country Kitchen it's also open to anyone in the community. It kind of started up with a lot of people were getting hampers and saying, like, you know, we have this stuff, but we don't know what to do with it. We have a lot of dry beans, thanks to our partnership with Viterra, and they were just kind of, you know, putting it up in their cupboard and not doing anything with it. So we got together with Family Center, I think it was in '95, and they provide the facilitators, and we provide food and services and facilities. So we're teaching them how to cook, you know, great healthy meals on a limited budget. What they do right now is they have cooking classes almost daily, and they make 2 meals that provide food for a family of 4.
Wow. And then they take it home.
And they get to take it home, yes.
That's
so
awesome.
It's been such a huge success that a lot of our community organizations have been coming and asking, you know, can we use your kitchen? And we just don't have the capacity. So that was kind of the idea of, let's build a community hall or facility for the community. Anyone is welcome to use it, and we will be using it for our continuing programs as well.
So, and people they're learning how to cook practical things to feed their family, hands-on. but they're also learning about nutrition and label reading and all those other practical things.
Right. We really believe in giving a hand up, not a hand out. So if we have food security and people have food in their bellies and they know what they're doing, then they can focus on the other problems that are happening or issues that they're dealing with.
So practical.
Yeah.
So if we walked into the kitchen, what would we see? What are the features that make it unique?
Well, it's a great brand new facility, and we're so proud that it has a dishwasher.
The other one doesn't?
No,
Oh.
no. Well, and it's a commercial kitchen, but with household appliances. That's why
Oh.
the dishwasher is. We don't want people to be intimidated when you walk into a commercial kitchen, right, with these great big appliances that you don't know what to do with.
Okay.
So we have everything on a household level, the same stove, the same sinks and everything like that, that when you do actually, you can take home what you've learned at the kitchen, right? There's no point in me learning how to cook on a great big gas stove top when I don't have one of those at home.
Exactly.
Right? So and it's a multi-purpose. It can seat up to 100 people. So events, workshops, and everything like that. So if you needed the big space with the chairs and the tables, it's there. But also you can cozy up into the kitchen and have a cooking class. So it's really, really a multi-purpose facility.
Do you have any idea we can share with people about like the usage, how many people are using it, and what you sort of see in the future?
So last year we had 1,600 participants in our cooking classes.
Wow.
That was alone the 1,600. So with partners and children and everything like that, we were able to provide services for 6,000 people. We plan on doubling that this year is what we're hoping for, because they'll continue the interfaith, the kitchen will be continuing with their classes, and then we can do ours as well. So we plan on doubling it.
That's wonderful.
Which is amazing. Yeah, we're really excited.
How can people access the kitchen?
They can just give us a call and we will give you a short orientation, show you around, and see what it is that you wanted to do. If we wanted to go into a partnership with us, it's a bit different than if you just wanted to rent it for a fundraiser for my child's school. So,
Okay.
Yeah.
So if somebody did want to use the space for a fundraiser, what about things like making sure everything is food safe and all that?
Right. So we all have our food safe, of course. So if it's in partnership with us and we're present, then that's not an issue. If it's you privately needing it, then somebody has to have food safe on premises at all times.
That's a requirement.
Yeah.
That's great.
Yeah, and that's part of our agreement and that we have proof of food safe
So it's a busy place over there.
It is a busy place, and you're also all welcome to come and stop by and have a tour. We love showing off our new shiny appliances, and there's things going on there year round. You've got that beautiful little garden outside. Yeah, we have our garden, and that'll be starting up in March with our Seed to Suppers, and we plan on doing a lot of workshops in there, and
maybe you'll come back then.
Yeah, you'll have to come and do some footage of that as well, because it's so amazing. What I love about the food bank is that there's just so many programs. Everybody that tours always is so surprised that it's so much more than a food bank, and that is really our vision of the hand up, not the handout. Mm-hmm. There's so many other services, and we do literacy programs and tax workshops and support groups and such. So it's parenting groups and.
Wow,
yeah,
it's like a college.
Yeah, well, we want it to be
Life
the
college.
one-stop shop for everything. Mm-hmm. Yeah.
Well, thank you so much, and you come back and see us again in the spring, and we'll talk about some more things.
We will. Thanks for having me.
Thank you. Thanks so much for being with us today. That's a wrap for this edition of AHS Health Matters. Thanks to all our guests for taking the time to be with us and share today. If you want to check out AHS, Alberta Health Services programs and services, please visit www.ahs.ca, and we'll see you next time on AHS Health Matters.